Hello. Hi. I don't think I heard the recording in progress cue, but okay, other people heard it, so just making sure I'm the one who missed it. Okay, well, welcome back, commissioners. Welcome to our next group of community partners. We are set to talk about targeted populations in the youth sector, and we have a couple of supplemental requests in front of quite a few supplemental requests in front of us in this area. And I'm looking over to Katie, who I think is going to introduce topic and our partners.
Thank you, Commissioners. Katie Fitzgerald, Criminal Justice Coordinator. So your partners today reflect our community agencies that provide services to a lot of our youth. I'm going to let them introduce their staff, but the agency is represented at the table today. We have Van Gogh, O'Connell Children's Shelter, Community Center for Supportive Communities, a new partner request this year from the Boys and Girls Club. So that's a partner that we haven't historically seen in this group. CASA, and then also the Children's Advocacy Center. Of those agencies, you have 4 supplemental requests, 2 that have been talked about in our recent business meetings around truancy. So O'Connell and CSC have submitted supplemental requests for broader truancy services. And then we have 2 supplemental requests, one from Van Gogh and one from the Boys and Girls Club, both of which reflect an expansion of service and stabilization of funding streams that have either been reduced or potentially at risk of being reduced from the federal and state levels. So with that, if y'all want to introduce the individual staff members at the table and
Yeah, I was
start with
suggest we can go down the line and do introductions. And if as long as the button is on and the mic is hot, you're good.
Hello, welcome, I guess, to me. Hi, I'm Catherine Clark, and I'm with Van Gogh.
Good morning, and thanks for having us. My name is Lori McSorley. I'm the Executive Director at Van Gogh.
Good morning. I'm Lacey Maltby. I'm the CEO of the Boys and Girls Club. Thanks for having us.
Hi, I'm Bev Turner. I'm the Executive Director of the Children's Advocacy Center of Douglas County.
And good morning. I'm Eric Vaughn. I'm the Executive Director at Douglas County CASA.
Kelsey Dockman, Executive Director of Center for Supportive Communities.
I'm Erin Harmon. I'm the Prevention Services Director at O'Connell Children's Shelter, and our Executive Director, Gina Meyer Hermel, is behind us.
Thank you, everybody. Thank you, Commissioner Dorsey, for lending your microphone to the end of the table every time. Commissioners, anybody have a question top of mind that they want to kick us off with for this hour?
Why does everybody look at me?
I looked everywhere.
I'll start with some questions for Van Gogh. That's all right. And I know the WIOA funding, that's one of the big risks here with some changes at Workforce One. Are some of your programs more favorable to them than others, or are they kind of looking at, is this an all or nothing in terms of their funding?
That's a great question. Thank you for asking. All of our programs are susceptible to WIOA funding, and we actually found out that August 31st is going to be our last funding date that we receive WIOA funding.
Okay, thank you.
Lori, can you talk a little bit more about just other avenues that you are exploring and contingencies based on the volatility of the WIOA funding recently and the anticipation of this end date that you now know about? What other strategies and places are you trying to make up for that?
Yeah, thank you for asking. So it's a large portion of our budget. It's a third of our budget that we're losing. It's 300,000. So we are looking at other federal grants. We're looking at grants through the criminal justice system. Actually, one of the things that one of the things that we do is we're an early intervention crisis intervention program, and so we prevent long-term disconnection with school and gainful employment. This was the WIOA. I guess I should say that the loss of WIOA was unexpected. We have been receiving WIOA funding for 23 years now. And the transfer from Heartland Works to Kansas Workforce One has been a difficult transition. And so we've seen it coming, but we just now have heard that it is actually coming. So we are still looking for funding opportunities, but we are reaching out to foundations that we've never reached out to before. We're reaching out to our donors, and we're getting new donors in the door. And like I said, we're looking at different federal grants because, as you can imagine, a third of our budget is not going to be filled by just one ask from one person.
So with an August 31st end date to that funding, what do you anticipate the most immediate changes or adaptations the organization is going to have to make for the remainder of this year?
We have already decided to cancel some programming that we have. Our pre-employment preparation program is a program that we typically have at the end of the year, and we are not going to be able to do that this year, unfortunately. We are also looking at reducing the schedule. So our TAT program, it's called the Arts Train. It's our 18 to 24-year-olds. They typically have a 9-month program with us in which they explore job opportunities. They learn about all sorts of things that are going to help them either get a job, get a certification, or go into school. That program is going to be reduced. We're planning on ending that at the end of December, unless we find other funding. The JAMS program, we're going to reduce by 5%, which doesn't sound like a lot, but when we are, dealing with kids that have complex issues, the cost isn't measured in dollars, it's measured in opportunities for people. And we're just going to need to limit and reduce those programs, unfortunately, which is going to leave a significant number of eligible students without critical services that we help with: school engagement, family instability, food insecurity, complex behavioral and mental health issues, which I realized that you didn't ask me any of that, but I felt like it was important to say.
And with you just mentioning all of that, when we think about those impacts, what other impacts will we potentially see to our workforce and or economic development for the populations that you're serving?
It's a great question. Thank you. One of the things that I mentioned in our funding request is that, there are public assistant utilization costs that are inevitably going to be higher because we are not employing as many people, or we're not employing people for as long as we normally would employ them. One of the things that we really work on is avoiding social justice system costs. We have a lot of individuals who come into our programs who have had brushes with the law, and it's our goal and it's our job to get them on the right path and get them into sustainable employment. Vanco generates a total of $12,000 to $39,000 in annual savings by just creating one job. And that's something that I outlined in the request as well. And that is between, payroll and tax sales, reduced involvement in the criminal justice system, lower utilization of emergency services. There's a lot that I outlined there that there could be a greater need for public assistant utilization.
Thank you. And do you anticipate that future years that any of that funding could potentially be returned as the system either corrects itself or figures out figures out that Van Gogh's model is something that works?
I would love for you to say that to them. Um, Given the volatility of the situation, I don't see that there is going to be an involvement of Van Gogh in WIOA funding, as long as the WIOA funding is kept with Kansas Workforce One. They went from a 17 county to 96 counties, and that has been quite the adjustment, as you can well imagine. And we've kind of gotten lost in that. We've tried our best to dig our way to the top and let our needs be known, but we haven't received any great feedback from them, or we haven't received any great replies from them. It's been a really difficult situation, unfortunately.
Commissioner Anderson, I'll just share that as the sitting commissioner on the Kansas Workforce One Chief Elected Officials Board, it is part of my goal to keep the conversation alive, but I would agree with Lori's assessment that given the direction of that basically statewide organization at this point, that the recapture of funding is probably not on the table. The possibility of other ways of working together and other contractual relationships could be a possibility, but as a board member, I can tell you that the direction that the board is taking currently isn't very promising. So I think Van Gogh is in a position of finding alternative ways to fund their programming. Commissioners, other questions for Van Gogh? If not, we can move
I'll
on.
throw a quick one in, and I don't know that it's a great idea, but are there fees charged for any of the programs that you do at Van Gogh, or could they be on a sliding scale for folks who could pay? I know a lot of the target audience that would be prohibitive.
Yeah, that's a great question. So 67% of our population is in low-income housing. 76% of our population has a mental health diagnosis. 34% has an IEP in school. We're dealing with we are able to work with a very vulnerable population, and that vulnerable population has a vulnerable family system as well. And while we could explore a fee-based system, I'm not sure how that would work given the population and the vulnerability that we deal with on a daily basis.
Okay, thanks.
Thank you.
I have one more question for you. So we just got done talking with our economic development partners, and now we're talking with organizations that are serving youth populations and focused on youth populations. In my opinion, Van Gogh is both of those things. So can you talk to us a little bit about what your current relationship to other economic development partners in the community are, and how you currently work with them, or whether or not you're exploring any other avenues or opportunities with how to support? I mean, because to Commissioner Willie's question, you know, that your organization provides programs and services and it's providing employment, and you highlighted, I think you did a really good job highlighting some of the economic impacts of being able to provide that targeted employment support to youth in our community and help them transition into other jobs. So I want the commission and the public to understand better how it is that you fit into the economic development realm of our community and what partnerships might look like there.
Yeah. So thank you for this question. I'm going to piggyback a little bit off of what Lori said earlier, that I think it is good to note that most of this funding is going to paychecks for our youth. We don't offer like services that they have to pay for. In fact, we pay them. This is a job. And for a lot of them, this is the first job they've had, and we're trying to help teach them ways to be a successful employee in the future. A large part of that is bringing in people that they can learn from, how to show up in an interview, what to wear to an interview. Our clothing closet helps them find those clothing items as well, so they can show up their best selves, be professionals. Bringing in people for these life skill courses, like how do we set up a bank account so that we can show up our best selves and get all the paperwork done? Like that's not the glamorous stuff, but it's the important stuff. It's the foundation. Also with the Arts Train program, bringing in lots of people, but also getting them out in the community, having internships that this also helped us pay for. Instead of the companies that they're working with paying for an intern, we were paying for their internships through this funding. Again, with the goal that they would get hired full time after this internship. So we'd like to still continue doing stuff like that, making sure that our youth, as soon as they leave our program, are not just starting over, but have that foundation to build on with relationships, with people, with networking. As the community engagement director, my job is to always bring in new people, new organizations, and I would love to work more. I try to go to as many chamber things as possible to try to facilitate that relationship. But again, that will always be a goal of ours, is to make sure that they're successful in employment, but how that looks and how that will change and adapt is kind of what we're exploring now with this challenge of funding.
Questions for other partners, commissioners?
Boys and Girls Club. Can you talk a little bit about your submission and what this would mean for your organization?
Absolutely. So right now we are in a financial situation where we are recovering from falling off kind of that COVID cliff funding that we got spoiled with for a little bit, and working really hard to diversify our funding. Just as Van Gogh said, our federal funding has been very temperamental. We receive three main federal funding sources: 21st Century, TANF, TUGEN, and AmeriCorps. This proposal is really setting us up for longer term sustainability while we build other funding streams. It'll also allow us, once we stabilize, to expand our services. We've had conversations in Eudora and Baldwin City, and we want to make sure we're serving as many locations in Douglas County as we can.
Can you talk a little bit about the population that you serve and the ages?
Yeah, so we serve youth kindergarten up to their senior year of high school. 48% of our population qualifies for free or reduced lunch, which is how we qualify them for discounted scholarships.
You mentioned that you are in conversations with other communities about possibly expanding services into those schools. But just to clarify, right now, all services are provided within the Lawrence School District only, correct?
That's correct. Except for summer, we have kids from Eudora and Baldwin City come to our summer program.
Got it. Thank you. Can you talk to us about what other municipalities or school districts or other public entities you have talked to or explored funding opportunities with?
The main focus has been partnering with companies for sustainability. We recently entered into a partnership with Savers Thrift Store, which will be opening in August or the end of July. And we will be the exclusive recipient of some of their proceeds. So that's an example of an additional revenue line that we're moving forward with. We would love to include a proposal for the city. We used to receive a percentage of the alcohol tax, which went away in about 2022. So that's on the list to address in the future as well.
Just to clarify, is the intent to go back to the city to try and determine whether through special alcohol tax or other avenues there's possibility to receive funding?
That's correct.
Is that something that's true for this year, or that's more of a long term?
Longer term.
Okay.
We'd be looking at 2028 at the soonest.
Okay.
This is not a question for a specific partner, and anyone can jump in, but I'm interested in your relationships with school districts on the whole, especially their federal funding through Title 4A or Title I, or, or even their overall budgets as well, because, if you look at You look at it, Douglas County tax bill, the largest portion is for the school district. So I'm really interested to hear how you're leveraging that relationship with school districts. If there's braided funding, is it more of a partnership? Leave it there.
I can kick us off. So the Lawrence School District is our main partner. We partner with them on our 21st Century Learning Grants. We wouldn't be able to get them without the school district. We also benefit from that partnership. For example, this summer, all 3 of our combined sites were able to receive free nutrition program because of the partnership with the school district.
Oh,
I was just thinking about how with O'Connell Children's Shelter, it may not be funding directly to our prevention side, although we have very tight relationships with all of the school districts in Douglas County. But we do get some funding through the school district for our residential group home program. So I did want to make that mention.
From Lawrence School District only? Or just checking since you're countywide services, so. If you come up and use the mic, you can. Sure.
So sorry about that, Gina Meyer Hummel. We actually bring in money to the school district for our youth who are placed here in our residential program because most of them do qualify for special funding. So we bring in a significant amount of money into the district because the youth are placed with us. And so then in turn, the school provides obviously services to support those young people. So, I mean, I think in the end, it's a wash in terms of nobody's making money, but we're certainly bringing additional funding in to take care of those youth.
Got it. That's helpful. Thanks.
So Eric Vaughn, Douglas County CASA, we don't have any funding from any school district, although about 45% of our kids are placed in the Lawrence or Douglas County School District. And so we obviously partner with them. Most of that work is happening at the volunteer level. So at the classroom level, working with teachers or social workers or that sort of thing. We do have occasional meetings with administration to talk about things that might be challenging and to partner different, how should we approach them for release of information and those sorts of things. But we do that across the state. But the majority of that work is happening here in Lawrence School District.
You're looking at me because you know I'm going to be like ditto.
Ditto.
Bev Turner from the Children's Advocacy Center. I would kind of mirror what Eric said. Although there isn't funding going back and forth, we have those ongoing partnerships, whether it's consultation when there's a child where there's concerns of abuse. And then in about 2 weeks, we're hosting with the school district and Lawrence Police Department and the DA's office a professional conference for 5 days at the district offices. So it's not costing them anything, but they're letting us use their building. And it includes special training about school violence with cyber threats and that sort of thing. So not direct funding going back and forth, but ongoing consultation and education for staff about mandated reporting and working with the social workers. And we accept referrals from them from some of our specialized therapy, mental health.
So Van Gogh also has a relationship with Lawrence Schools District. We don't receive any funding from them. However, I appreciate that suggestion and I'm definitely going to look into that. We receive referrals to our social workers at Van Gogh from social workers in the Lawrence Schools District for people who would be a good fit for our program. And our social workers at Van Gogh work very closely with counselors and social workers in the Lawrence School District to help make goals and see those goals through for our shared referral sources.
So we do not receive direct funding from
any of the school districts, but we have been in conversations with administration and with school board members. I think there have been a lot of positive changes within USD 497. There's a lot of really positive ideas, especially around family engagement with their new center that they are building. I will say we meet with them monthly. We have a multidisciplinary team meeting with truant kids, and they've been super helpful with providing data. And some of our mentors will actually meet in the schools with the kids. So if we feel that safety is an issue and we don't feel comfortable with them meeting in the community, they do open up their classrooms for our kids and mentors to meet.
Follow up on that for Dr. Dockman. Are there any conversations with the school board or any of the school boards about offering the AmeriCorps match for CSC?
Yes, I think everyone's kind of been waiting for the decision that was last week. But now I think there will be more conversations about it. Our match, though, is already covered because we have in-kind professional service donations, and that can be used as our match.
Great. Do you have and I didn't see it in the materials, but let me know if I missed it, like what do you call it? A fee per kid or a cost per kid that you put out to communities for if they want to engage with you, whether that's a school district or any other entity?
We don't do it per kid just because every kid is different, and we're also working with the families. So some of the kids require way more of my time versus the mentors can really handle themselves. I usually get involved in the more intense cases, but that's definitely something that we could explore, is trying to figure out what a cost per family would be as a way to get some more funding and open those conversations.
Thanks.
More questions, commissioners?
I have a question. I'd just like to make a comment that all of the organizations here at the table tend to work more upstream. And I appreciate all of you for working with the kiddos, because I think the more work we put in at a younger age, the better off we all are later on. So just thanks to all of you.
I have a question based on that. So in my time on the commission, we've continued to add partners in this space, a lot for youth services as a vulnerable population. I'm interested to hear how you all are working together. Earlier we heard from our fire department and emergency communications, and there's real integration and training each other, trying to figure out the right way to respond to a crisis. I think our economic development partners have been working on that as well. How is this group, and maybe there's some others outside of it that are also working in partnership to help a student, whether they're a middle schooler and they're not going to classes, but Van Gogh might be the right connection, but it also may be CAC. I'm just interested in how this group is working together.
So I'll start, if that's okay. I think I've had conversations with most everyone at the table. We partner with O'Connell probably the most just because they're the other truancy program. So we'll have kiddos, we'll sometimes have siblings who are with the high school program and we're working with their younger siblings. So we'll collaborate that way. We also, again, are in meetings about different cases. We've helped schools streamline their referral process, and we conduct training together with the school districts and the court system as well. We've definitely been in conversations about training. CSC, when we transitioned from KU, we created a 40-hour online asynchronous training, and that I think could help a lot of partners. And so we've definitely talked about partnering on that and doing more in-person trainings on like crisis management. Van Gogh, we definitely share some kiddos. And that has been a really, really cool experience seeing just the overlap in our services related to education and getting to school, and then your services and employing them. And to see their progress with you all is incredible. So we definitely love our partnerships and hope to continue to expand.
So actually, partnerships with other nonprofits and for-profits, for that matter, are very integral to our programming. We have education and life skills that we bring in for our participants. We talk about issues like healthy relationships, drug and alcohol prevention, suicide prevention, and then we also talk about things that might seem basic to some of us, but are not basic to everyone. And so we work with so many not-for-profits to come in and help provide that information because they are the foremost experts in their own realm, and we really rely on them to help us help our kids.
The Boys and Girls Club has on average about a dozen community partners at a time. We are currently in a partnership with Van Gogh, coming in and working with the Center for Great Futures, which the kids have thoroughly enjoyed and benefited from. We also have worked with Peasley Tech on both a staff training level, internships for our teen program, and just general technical skills for our members throughout the school year. We also utilize like Merton Nash for their mental health services. We have a team of 7 counselors with over 200 kids on their roster to make sure that they're getting proactive intervention and responsive intervention, which requires really bringing everybody in from the community to help them and their families. I will add that just summer program alone puts an average of $35,000 back into the community for other nonprofits for our program partnerships.
So on the O'Connell front, I think we have touched everybody at this table at least. And I also, all of the members who are not here in the room tonight, I don't think there's an agency that I can come up with right now that O'Connell hasn't partnered with in Douglas County, but also now in surrounding counties. And I think at a state level as well. I know obviously Dr. Dockman, and that is the closest, but I've been with CASA and Van Gogh, and we have kids in both our residential programs as well as our prevention programs that are accessing all of these services. But we also have worked really hard in the last year through some state funding and some other programs that we have in prevention to create MOUs with the Douglas County Housing Authority, with Panda Pediatrics and Heartland. We have one for the truancy kind of advisory group. So I think it's opening doors all over the place for our agency to really not only leverage our partners, but them to be able to utilize us as well.
Yeah, so ditto to what's already been said, and yeah, I think some other partners that maybe haven't been mentioned. So we partner with DECA a lot on use of their prevention services and training for our volunteers, and just also our community partners that we work with. So KVC, who's the case management provider in this area. We've been focusing on the past year just on substance abuse prevention, education, and I've had conversations with with multiple partners here at the table about how we could use that grant to provide training for them. And we're still working on that. And that's the Kansas Fights Addictions grant. And then also, yeah, Bert Nash also, and we're referring kids from this community to Boys and Girls Club and also to Van Gogh and their services. So, things challenging situations and funding and that impact other organizations in this community impact our kids and each other. And so, yeah, I think we're in communication frequently. And that's not just me, that's also our community engagement coordinator, development director, and supervisors who are all have other relationships with these partners and others that are doing that on a more day-to-day basis. So, yeah.
Thanks. Seems so sensitive. Again, from the Children's Advocacy Center, I would mirror what everyone says. We do partner quite a bit when you talk about first responders, obviously on the investigative side. So when kids first come into us, it's usually for a forensic interview. And we oversee that multidisciplinary team that does child abuse investigations. So that's going to be our district attorney's office, all law enforcement in the county, DCF, Burt Nash is there as a mental health partner, LMH, CMH, Children's Mercy Hospital. So we partner with all of them on that end. But when it comes to our family advocacy, so when they're in an interview, the advocate's meeting with the family, and that's where referrals to all the agencies that are up here are happening. So I highly doubt there's many kiddos that anybody served up here that didn't come through us first or went to these guys and then they ended up back with us and back to them. And so without that, no one of us can do everything. And I think you said it well, that everyone should do their specialty and not try to somewhat do other things. And I think that's really important. And so I really value when we have kids that are vulnerable and we're trying to get them through to the next phase in life, that I can refer them. I'm thinking of one in particular to Van Gogh to say, hey, we need more support for this child in a healthy way. And that's what's really important.
I just want to add real quickly, we couldn't do the work we do without our partners. Like we really are all lifting each other up. We all care so deeply about the holistic approach and like caring for this person holistically. We all do it in our own way. I'll also say we've applied for grants together. We've done a lot of collaborative grant applications. We're also doing some events that we can, if we can come together and, a ticket the money goes across the board. We'd like to do that. So we're exploring more and more options as we can, because again, we all need each other and we all work together basically. This is one unit, it seems. Yeah.
Thank you for that. Thank you, everybody, for your responses. And Catherine, I appreciate knowing that I was going to ask if there had ever been any collaborative grant opportunities that any number of your organizations have thought to, because I think sometimes that's a powerful thing when you have multiple organizations coming for a well thought out ask, that can be helpful. So I'm glad to hear that. I guess my follow-up question is, so I'm familiar with the multidisciplinary team that's the first responders and law enforcement entities and a couple of providers in the community related to, children that are involved in abuse and neglect cases. Beyond that team, which is so specific to the legal system, really, is there a group, or has there ever been a group or team of youth providers in Douglas County that are gathering on a regular basis? I mean, you all highlighted some great examples of how individually you might collaborate, and some partnerships have developed here and there between your organizations. Is there anything more comprehensive that's taken place, or that you all, if not, have considered thinking about for future longevity?
Well, I just wrote myself a note to follow up with this group of people. It's more been around situational things where we've rallied together. So like when the AmeriCorps funding was taken away at a moment's notice, getting together with Ballard Center and the other entities that utilize AmeriCorps to make sure that we're working together for the greater good. But I definitely see so much opportunity. We primarily partner for our programmatic pieces that are touching the kids, but I think at a higher strategic level, there's a lot of possibility there.
And then over the past year, I've been engaging with Justice Matters, because last year they chose trauma as one of their topics to investigate. And so I've been, I think, on the stakeholder group that's been looking at that, and they've already made their recommendation at the Nehemiah conference. But one of the things I've been advocating with them for is they did convene a meeting and City Commissioner Sellers was a host of that, and I, because I was a community partner involved in helping plan that, ended up, I guess, co-hosting that with her. Anyway, so we still have conversations ongoing about we would love to bring that group together again, because I think most everybody was at least invited to that, and I felt like that was a good start of a conversation, collected a lot of information. And yeah, schools were there also. And so that was a really good start of a conversation. So I've been advocating for that to happen again over this next year. I'm not in control of that group. I'm a member of that group, but I'm not part of the different faith communities that drive that model. So we're advocating to keep that continuing and see what happens. I think we'd be committed to making that ongoing if Justice Matters didn't, but it'd be great to have their support in doing that.
So the Chamber of Commerce, pardon me, the Chamber of Commerce has done a really great job recently of getting nonprofit groups together and having us work on some of the issues that we all share. And so we just had our first kind of get together not too long ago, and that's going to hopefully be the first of many. And I think that relationships are growing from there. And I would love to see a youth provider group come out of that too, because I think that one of the things that they're really stressing is that leadership is important and anyone can lead anywhere, anytime. And we just need to get into the same room so we can get some really great people together to do some really great things. So the Chamber of Commerce is an organization who has started that effort, but it's in its infancy right now.
Just 2 seconds. Our family advocate has been scheduling pretty much quarterly meetings as one of her goals for a national grant that we have specific around advocacy though. So we have the Willow, the Care Center, the DA's office advocates. So really specific to our work, but how do we navigate when we have confidentiality, things that need to be met, but yet we have families in crisis who have kids with them, and then how can we work together? Also to make sure that we all know what everybody does, because we get a lot of so-and-so told me to call you, and we're like, I know somebody, but that's not exactly what we do, but making sure that our advocates are educated so that nobody gets a cold shoulder when they reach out.
Really quickly, I think too, with the community health plan, some of the work that Bob Tryansky is doing in D, I was working with them a little bit about truancy, because truancy and chronic absenteeism are on the plan. But I think that would be an interesting avenue to explore too. I don't know how confidentiality issues would work with that, but I know many, many years ago, there was a multidisciplinary team meeting of providers. I don't know what happened to it, but I think variations, COVID. I think variations of that have popped up, but I think it would be really interesting to get everyone together.
Thank you, Kelsey. I was just going to bring up the CHIP, the Community Health Improvement Plan, because a lot of our work is tied back to the Community Health Improvement Plan, and it does engage our entire county. And the CHIP is also tied to multiple objectives, which is aimed to improve our community health overall. And it's something that we can track, and we've been tracking for multiple years. And our health department is also engaged. We can also engage the chamber as well and bridge and bring in multiple perspectives. And it's also tied to multiple grants too. And so we could also align multiple grants, multiple objectives that other community partners are also working on, and then bridge those multiple sectors, economic development, but also social determinants of health, and then pull in those health metrics that we really want to improve across the county. So I think that's a great suggestion, and something that I was going to bring up as well as we seek to really integrate our system overall.
I have a different question. Is that if people are ready for that? Probably mostly this was with CASA. One of the things that we look at when we're looking at all our partners is like is how much fund balance do they have enough to be healthy? Do they, if they have a significantly large amount, it just giving you an opportunity to talk about what are the purposes of that and how does it impact your work, and do you have plans for it?
Yeah, so the short term, year to year use of those funds is reinvesting those funds back in the organization. And so the policy is we use 5% of the past 3 years gain and reinvest that back into the organization. And so every year our budget is, a negative because we're reinvesting. It's about $90,000 back into the organization. This year, we're increasing that amount by about another $200,000 just for different growth focus areas that we're working on. I mean, my big grand goal for this long term would be we would love to grow it into an endowment for longer term sustainability, but that's probably, I don't know, 10 years at best down the road, and having some specific conversations with some donors who would help us increase that endowment so we would not need to do as much grant writing and get funding from other areas and have long-term sustainability. So that's the use of those funds now, and that's a board policy that's in place. Obviously that funding would be available to us to pull and use directed by the board and whatever, because it's money that the board has access to. But my limit as executive director is just that's allocated annually year to year in the budget. Yeah.
All right, thank you.
May I answer that as well? Okay. So given the loss of federal funding, our fund balance is our safety net at Van Gogh, and we will be dipping into that. Unfortunately, this year, because of the loss of federal funding, it's intended for the safety net, and it's something that our founder, Lynn Green, built before she left. And it's something that is absolutely going to be essential to us being able to continue to survive.
From the O'Connell perspective, we're kind of in that same boat where our funded balance is what kind of we go to, if need be, through our fundraising efforts for Festival of Trees and just various fundraisings, also our capital campaign and things that we've done over the years. And we really try not to touch it, but I think everybody's kind of sometimes in that position. So I just wanted to add that from our end.
Commissioners, I just want to take the chance to see, we've had a lot of conversation about truancy here recently, and lots of commentary from some commissioners about getting to our budget discussions related to the supplemental requests we have. So just want to make sure I put a point on that and ask if any commissioners have any questions about the 3 different supplemental requests that we have in front of us related to truancy in light of the board's decision at last week's business meeting.
Let's talk about truancy. Okay. Let's talk about truancy for moving forward. So we have a couple of requests before us. We had a board decision last week that changed our truancy program. And so now we have 2 requests before us, and we have a new program that the county has decided to fund that will change the work that we're doing. The county is currently in a process of redoing an MOU with DCF, which should probably have some community partners in it. So what are thoughts around partnership and how we should maybe move this program forward as we look towards 2027?
So we will continue to be operating through our AmeriCorps grant. Obviously, that's going to be a little tight. We also have other plans to expand our funding in other ways, but just focusing on partnership moving forward. We've always collaborated with Criminal Justice Services. That's, for the last 15 years, we've always collaborated with them. I hope that we can continue to collaborate with them. We still have our mentors and our staff and volunteers. So we would love to continue to offer those services. We definitely want to be involved in the community health plan. We had a really good start of that before the AmeriCorps funding issue happened. But I want to get back to doing what we had planned and meeting, with schools and figuring out what data we want to collect and focusing on outcomes. So we plan to stay involved in this work, and hopefully the program that you approved, I think, is a good one. It's case management, and I do think that CJS needed an extra juvenile services officer to help. When we established the MOU in 2023-24 school year, our student referrals increased by, I think, 320%, if that's the number. I think that's so obviously that increased the what Kate was doing with signing the families. That increased a lot, so we had to figure that out. We've already had talks in 2024 about CJS needing another juvenile services officer. So I'm viewing this positively, and I think it's good that they have the extra support, and we are here to help in the transition and hopefully continue our services.
I think from the O'Connell perspective, because we have traditionally been the ones overseeing the high school truancy versus the elementary middle school, that part of it overall won't change necessarily from our perspective. I mean, there's obviously every year edits to the children and the families and your services in general. But I will say that this does change how we've all operated for over a decade. And again, like Kelsey said, not necessarily a bad change overall. I just think that we need to go back to the drawing board. And what I would like to see is that all of the partners who've been in this game for a while and are, somewhat experts in what we're doing, be able to reconvene, because I think that's been the biggest issue or downfall in all of this, is that we've worked together for years. And so some of this, and I know Commissioner Kelly said it at the meeting, we had a bunch of partners who are wanting to do this work in the room. And we have to figure out a new path together, because we can't do it together. And I think you guys have seen tonight that all of us who are in the youth services and families, we can't. And so I think the next step is going to have to be a stakeholders meeting, and making sure that everybody who is doing the truancy work is included in the MOU, because I know currently O'Connell is not, and that kind of ties our hands a little bit. And so I would just like to see that we get to do the work that we have been doing, and keep trying to move forward. We put a supplemental request in to do the whole program, elementary, middle school, and high school. There was a lot of uncertainty, obviously, at that time, when we made the application, but O'Connell is about to celebrate its 50th year. We've been around a long time in the county. We've done a lot of work in the county, but our focus isn't just necessarily on the kids, but the whole family. And so we wanted to bring to the table an alternative for everyone, because I do think there is something to be said about the younger youth and families being served by criminal justice services. So, and what that may entail, and having that attachment to a criminal pipeline, and especially because truancy is a child in need of care law, not a criminal law in the state of Kansas. So what we wanted to do in partnership also with the school districts several years ago was support them in increasing not only their attendance rates, but their enrollment rates as well, and bring more kids back into Douglas County school districts and things like that. And so I think that O'Connell has the ability with the other programs that we have, our Generations program, which is a whole family model. We have the ability to do all the kids. We're not opposed, obviously, to still working together. We love our high school truancy program, and definitely gung ho, keep going, doing the work we're doing. But I just would like to see all of us sit down together and try to figure out what is truly best for the children and family in Douglas County.
We've experienced some evolution with some of our community partners around services provided and how we provide those services. We had a discussion just the other week. We didn't really make decisions about, an amount of money to put aside for social detox, and that we may have multiple partners who work in that space, and we have a set rate for that. We're doing an eviction, a tenant eviction pilot program, and we have 2 providers that are working in that space. Sometimes that can be a commissioner or staff sort of saying, hey, we think this will work well. I want to understand from before we start to go down a path that you're like, ooh, that's going to jeopardize federal funding. There's a way to do this. There's a braided approach. At our meeting recently, we talked about that there's not one perfect approach to addressing truancy, and I think we have some agreement on that. But I'm interested to hear if we took a different approach to funding truancy, what would be the impact? How might that impact your organizations? Kelsey, you referenced it a little bit, like finding that rate when things are up or down may have a difference. But I just want to, before we get too creative in our deliberations, I'd like to hear from you all a little bit about what that impact might be.
Yep, make sure you use the mic. I was going to say, Eric can pass you on.
So is your question, if we do not receive county funding, how will that impact CSC?
No, I don't think that's where my head is headed. I'm thinking about the programs that we have that we sort of say, here's the service we need provided. And it is not yours alone to provide. It's a team of people who provide that. And it might be good because one group has more capacity than the other, but there's sort of an agreed upon rate that service would be provided at. I don't know how that, I don't know what grant, what other funding you have, how it affects your AmeriCorps. It is, I think you referenced earlier, Kelsey, it is a little scarier because you don't have a set amount. So I recognize that. But I'm just interested to hear, as we think about multiple ways of addressing the challenge, is there opportunity there to think about who might be engaged? There may be a strategy that we're not even using yet today that, as Criminal Justice Services looks at the program, might do it a little differently.
I mean, yeah, it would be an interesting discussion to have. I don't know that I can provide an answer right now. Any funding that we can throw our way would be greatly appreciated. I don't know that we're in a position to say otherwise. We would be happy with any agreement. It wouldn't affect our grants. I will say, I guess would we do it based on like how many kids we are serving every year or something? I just think that just needs to be more of a discussion.
Yeah, I think it would need to be more. I'm not pretending to have all the answers here today, but what I'm really trying to explore a little bit is, we've sort of, in our budget request, it's been very much an approach of community partners come to us. They say, we want to provide this service. Here's the cost for the service. What we're discovering with some partners, or at least what I'm discovering, I don't want to speak for all my colleagues, is sometimes it's about the specific service and not the specific partner. That there's more than one partner. And I think the fact that we have these requests in front of us sort of highlight that we have more than one partner who feels like they can do the work. And how do we take advantage of each of their strengths and get more people circled around helping kids, to Erin's point?
Yeah, I guess from my experience doing this work every day, we are collaborating. We are using collaboration every day. We collaborate with O'Connell. We're in constant collaboration with the court, with the DA's office, with DCF, obviously with CJS. So I don't know that it's one organization. I mean, we don't focus on case management. If that's the approach the county wants to take. Obviously, CJS will do that. But my argument would be that we do provide a specialized program that not every partner is implementing. And we do bring a specialized skill set that not every partner is doing.
I'm going to have Gina come for a second and answer a couple of those questions.
Sorry, I want to specifically answer your question, Commissioner Kelly, because we leverage, I don't know why this is, we leverage a ton of state resources based on the Truancy program. The number of young people we serve in the Truancy program helps us to be able to establish in grants and other things our reach. So it is a critical piece of what we do to be able to bring in additional resources to children and families in our communities. And just like we bring in the young people who need residential care, and we bring in resources to the school district. So I think there's a good sharing of resources between what you all provide to us and then what we're able to leverage in terms of other grants and other funding. So I think that may be what you were speaking to, but because of this service and because of what you all have been able to do and to provide for us, we're then able to turn around and leverage that to bring in additional resources for families in our communities.
I think I'm going to pull on that thread a little bit. So you talked about collaboration and working together and wanting to put everybody at the table to keep talking about this. But we have what appear to be competing between the two organizations, requests to do the full program, taking over each other's work from the previous year, et cetera. Am I misunderstanding that? Is there more collaboration behind that than what I'm seeing, or is there an opportunity for that? Because it does seem like they are asking us to look at them in direct competition.
So during this whole year experience, I've learned that perhaps the county is wanting to reduce costs related to truancy. And I've looked at our budget, I've looked at O'Connell's budget. We are at 150 for 26 plus schools. For K through 8, we do functional behavior assessments, we do individualized treatment planning, we collaborate. We're also helping schools with their internal processes. So when I look at the numbers, if that is the route that the county wants to go, then it seems like we were providing a lower cost service to the county. So that was my approach. It wasn't intended to fight with O'Connell for services. I hope that we all can continue collaborating, but given this last year, it was my understanding that you wanted to remove costs, and which would mean removing community partners.
And I think my question is, did the two of you meet together before putting in these requests? Because you're asking us to convene a conversation that it sounds like perhaps the two of you did not engage in.
So, yes, I can answer that for you. O'Connell made multiple attempts to gather the community partners that have been doing this work for a long time. When we became aware that this was potentially going to happen and there was going to be a change to the truancy programming, that did not happen. Some partners were and it wasn't support ed, I want to say that. But we were unable to make that happen. And so I think that what we have found is that you guys have a bunch of community partners that are very passionate about truancy and the youth and families in our county. And it was never intentional, and I don't think any of our parts to go in a situation, but we didn't want to lose the program and the services for the families. And so we all just went headfirst into it to make sure that those services did not get cut altogether. So that's where we were coming from. And then we, of course, at O'Connell, we do have our lane of, again, believing that criminal justice services is not the appropriate pathway for younger children. So.
And I feel like I need to step in there a little bit because youth services has run juvenile intake and assessment. So, I mean, youth services has always had a role with youth in crisis and not necessarily youth in criminal crisis. So I just want to feel like I need to speak on behalf of our staff that not all of the work that youth services does is criminal related to children.
Yes, that's correct.
Thank you.
But also O'Connell did also run juvenile intake for several years. And so I think that it's just been a hard transition and we're all trying to find our way, and we've all still been talking outside of this. So
And I know I asked a question at the past our time, so forgive me for everybody. I was just trying to establish if there was a different way that I should be viewing these other than that they were independently created. And it sounds like those conversations, I'm not missing something within there. Okay, thank you.
Commissioners, other last burning questions for this group? Okay, well, I don't have a question, but I'm going to take a point of privilege and say that in addition to my idea that there be maybe some concentrated effort on a stakeholder group of youth providers and figuring out how you all are collaborating in consistent ways and bringing the different services and skill sets and funding opportunities that you each have independently in your organizations together to have some collective impact. Sometimes I like to pitch this idea from my high school years of I think all nonprofit boards should have it, but especially youth provider boards. If you don't have a youth member spot on your board of directors, I highly recommend it. That's all. All right. With that, we are adjourned for today. Commissioners, we will be back here at 5:30 for our business meeting, and the rest of you have a great day.